Hello, Chris Johnson, the co-CEO of TeleTracking, and I have with me today Andy Brooks, CTO and co-founder of Faculty.ai, and Mike Coen, our Chief Product and Technology Officer here at TeleTracking. We're looking forward to a great conversation about the recently announced partnership between TeleTracking and Faculty, and how we're bringing these two great companies together that have been focused in different ways on solving problems in this space, and how together we believe that we can do something even greater. So very much look forward to the conversation. And with that, and Andy, would you like to introduce yourself, please?
Absolutely, yeah. Well, I'm Andy Brooks, one of the co-founders of Faculty and the CTO. I look after our product business, and so Frontier and the computational twin technology, which I'm sure we'll talk a lot about.
And hi, yes, I'm Mike Coen. I'm Chief Product Officer and Chief Technology Officer at TeleTracking, and was one of the people that were instrumental in selecting Faculty as our partner.
Great. Well, thank you very much, both of you. So I've got a few questions to get us started, and then some of them will be directed at you, Mike, and some at you, Andy, but this is in context of everyone. How, from your perspective, did the collaboration between TeleTracking and Faculty come about? And what makes this partnership unique in the healthcare technology space?
I think Andy, I'll go ahead and go because I want to give people an understanding about where my thought process was. We first learned about Faculty a couple years ago, and really liked what they were doing, saw what they were doing from a project standpoint, and a couple of trusts in the NHS. And we decided at that point what we wanted to do is do a deep dive with the technology. I don't really just throw things into our platform without having an understanding about the value it might bring to us. So we went through a proof of concept, and we selected Faculty, went through a proof of concept with them, and that proof of concept was very interesting. The results were extraordinary, actually from our perspective. The selection was made primarily because of, as Andy said, he kind of manages the product aspect of the computational twin. Having that computational twin was a key component about what we wanted to try to accomplish. It gives us the ability to do simulations and empowers the end user, if you will, to bring AI into their hands instead of making decisions for them, allow them to make the right decisions that they know best. So that was having that proof of concept and working through those challenges and working through the value that we saw in that proof of concept has really made this partnership to be what it is today. And it was all started with just seeing the work that the Faculty team has done throughout the NHS with us.
Andy.
Yeah, so from my perspective, so we both as organizations been working in healthcare and the NHS for years. And I was reflecting on this the other day, actually. In my mind, so we were looking for a partner where we could scale the impact of our technology, especially someone that had years and years of experience dealing with the real gritty difficulties of getting operational software into a system like healthcare. And I think of our partnership as starting in earnest when Chris, you and I met for the first time. I think it was in Maidstone, and we were both independently working with that trust, and we were lucky enough to get given a tour of the hospital, which included seeing the TeleTracking technology in action and speaking with the end users. And I just remember thinking, wow, this is actually this is brilliant. This is what all hospitals should have. And then both Chris and I gave an overview of to the Maidstone senior team of our different perspectives on healthcare and technology. And something that really shone through was both the just the mission-driven nature of the organizations, the care about focusing on the impact, where technology is an important piece, but it's what it can deliver to patients, to nurses, to doctors, whatever it might be. And that to me was when I felt, okay, this could be something great. And that got me quite excited.
Great. Well, I'll give you my perspective a bit. As we went through, I agree with you, Andy. I remember the first meeting that we had. But I think as a leader of a 35-year-old company that has been focused in this space, one of the things that I've learned over my tenure and time here, the people matter. And who you partner with matters, who's on your team matters. And as a mission-oriented, a mission-driven company, I saw the same thing reflected in faculty. I would say the other thing that really stood out to me was a shared experience that the three of us had actually during the time back in 2020 with the onset of COVID. And Andy, you and your team work in healthcare and defense and intelligence and other areas, but TeleTracking and faculty were both called at a point that there was a massive crisis that was happening in order to provide capability, visibility, and solutions to do the work of our respective nations during that time. And we shared quite a few stories on the challenges there and facing the unknowns and what we had to do as leaders and what our teams had to do in order to deliver that. And from my perspective, that created a really unique bond that I think has continued to play out as we continue to work together moving forward. And I'm very excited about the ongoing partnership. Mike Coen, so I'm going to direct the next question at you. Excuse me. TeleTracking has been a leader in healthcare operations and patient flow technology. How do you see faculty's AI capabilities enhancing the current operations IQ platform?
Oh, geez, that's a great question. So I see it in so many different potential use cases in terms of what we can do together. What we do today very well is that we move things. We move people, we move assets, we move staff. We make sure that they're doing the right thing at the right time. Sometimes it's really make sure that they're doing the thing that we tell them to do at that time, and it may not be the right thing. So when we talk about what we're engaging on with faculty as our partner, I think of things that will enable us to make the exact right decision at the right time, so that a patient or a nurse or some sort of staff member are being put in the right place at the right time to do the right thing, that ensures that we are providing the level of efficiency and movement that we need to be providing to improve discharges, to improve transports, whatever it might be, that are necessary for us to be able to get to the pinnacle of what we want to, which is basically unobtrusive flow movement that people are just happening, they don't know what's happening to them. A good example that I have, so right now we're talking about things like transportation optimization outside of the four walls of the trust or the hospital. But what we do, their first proof of concept is with discharge optimization, right? That's how do we make sure that the nurses are working on, the staff in general are working on the exact right things at the right time to ensure the most beneficial discharges are happening at the right time. That's extremely valuable because it makes sure that the staff knows that patient X is probably the highest value target you need to be working on in terms of getting outside of the hospital, getting home. Thinking of things along the lines of where I'm really excited about as we start going outside the four walls of the hospital too, whether it's optimizing transport, picking the right ambulance to be at the right place at the right time, or optimizing what patient potentially at a tertiary community hospital somewhere in the countryside, what patient is likely in that organization to be able to next be the patient that needs to move into one of our primary care hospitals. So the things that we can do with the technology the faculty brings on top and sits on top or beside our flow is going to be just stuff that makes flow be so much better, more accurate, more efficient. And all we're doing at that point in time is continuing to save money and save lives.
Great. Thank you, Mike. And kind of continuing along those same lines, Andy, what is the core advantage of faculty's AI technology when applied to healthcare operations, and how will it improve the day-to-day workflow of healthcare providers?
Yeah, so the core technology that that we're bringing is we've mentioned it already, the computational twin. And so the way you should think about that is there's a lot of promise and there's a lot of hype around AI. Um, and the computational twin is really about connecting AI models in a way that makes them useful for an organization and useful specifically around their decision making. So helping them to improve the key metrics that they care about. And like Mike was saying, that like a lot of time that's going to look like improving patient flow to uh, improve patient outcomes, reduce cost, and increase revenue. Um, and so the core of that really is helping to improve decision making and helping to support decision makers by giving them insight into what's likely to happen within their hospital. And so giving them the ability to play around with different possible setups and configurations of a hospital, different forecasts for admissions or length of stay, all in the service of moving from like I can see what's happened in the past and I can see what's happening right now, but I'd like to be able to see what's going to likely happen in the future. And the computational twin is technology that allows you to do that.
Wonderful. Excuse me. So this is actually a question. I'm going to send this back to both of you. And I think you've touched on it a little bit from different points of view, but really for the context to kind of wrap that up. What specific challenges in healthcare operations are you aiming to solve with the AI-powered platform? And how do you envision this impacting hospital efficiency and patient care?
Mike, do you want to
so
sort of,
yeah,
I feel like you've covered some of that already,
I think I
and
did
I can
already
add
cover
to
a lot
it.
of that. Yeah. So just to re-emphasizing some of the stuff, there's so many opportunities for us to think about what we can think about and how to apply this capability into our platform. Again, the examples that I have were we're considering things like what is the right ambulance to be called at the right time based off of ambulance location, based off of staff, based off of breaks, based off of understanding not just geospatially what available, but what's on board of that ambulance, things of that nature, to be able to say this is the right ambulance to go pick up that patient and move them. And oh, by the way, it's going to, whatever it is going to obviously for the outcome of fastest speed to the next level of care. Similarly, and more extensively, when you think about that tertiary site, having them being able to having visibility, we provide TeleTracking. We already provide that visibility into that tertiary site. A primary care facility or a high level of care facility can actually see the beds and the patients that are in those beds. Now take it to the next level is I want to know if that patient number A in bed 17 is patient A likely to be moving from where they are to another level of care in the next 24 hours, because I have to plan for that. So being able to use the computational twin to run through some cycles like that, and what we're doing with discharge optimization already is a perfect proof point of empowering the end user to make those decisions, not just using AI to decide for them. So very excited about that.
Thanks, Mike. And so I think we've addressed some of that around the predictive and things of that nature. And I'm going to direct a different question to you, if that's okay. With AI being a major transformational force, what do you see as the key factors to successfully integrating AI into a sensitive data environment like healthcare, where patient safety and privacy are paramount?
Absolutely, yeah, that's a really good question. So I think there's two critical pieces. The first is around actually embedding it into operations and meeting the users where they are. So like I've already sort of spoken about the focus on decision making, and people that are using this, like using teletracking, like extremely busy, time poor people, we need to get insights and the capability that AI promises into their like fingertips when they need it the most. And so there's real focus on the actual operations, how people like mapping it to how people are actually acting day to day, and that just needs to be like core to everything we do. So very like user-centric approach, independent of the technology essentially. And then the other piece is trust and safety. So these are decisions that are life and death decisions. They're extremely critical, and possibly some of the most critical decisions that get made in any situation in the world. And so anything that that AI is doing needs to be trusted and it needs to be understood. And so it can't be this black box system that just spits out, you should do this because I say so. It needs to be like, here's a recommendation for you, and this is why I recommend it. This is the information that's flown into it, and this is also these are the steps that I've taken to coming to this answer. It really needs to be truly explainable. And that's one of the benefits of the computational twin framework, that it allows you to ground the forecasts that the models are providing in the true operational structure and realities of any given hospital.
So I'd like to add to that real quickly, because Andy, I think you made a very key point there. I think empowering the end user, right? So you're, like you said, you're giving them the decision to say, okay, this is what I want to go forward with. So in our first use case, we're empowering an end user to say, I know this business very well. I know this part of the hospital very well in terms of patient flow. I'm going to make an active decision to employ this model. Now, the downstream effects for that are telling a nurse that, hey, patient X should be the first one that you're looking at today and trying to get discharged. They don't necessarily need to know why that has occurred, because it's already been planned for them. They're being told that's the right thing to do, but it's been told because somebody upstream has made a decision within the business to say, this is the model I want to employ.
Thank you, Mike. Thank you, Andy. Mike, I'm going to direct a question to you. Excuse me. TeleTracking has a wide global presence in health systems. What kind of feedback have you and your team received from current clients regarding the integration of AI capabilities into their operations?
Well, it's very clear that they're hungry for it, right? I think it's more than just they're paying attention to the market, and generative AI has changed them, and they're seeing the value in their own day-to-day own personal lives and day-to-day work that they're doing. But they're hungry for it. We did several voice of customers to make sure that we are hitting the mark with the technology, and all of them said, this is an absolute need that we have. You need to be doing this for us, and we like your strategy. We like your approach. You're enabling us to do the things that we think are right, as opposed to making decisions on our behalf that we may think are wrong. So they like the strategy. They're hungry for the need, and let's be honest. If we can do anything more to continue to improve efficiency into the platform, we need to do it. So our voice of customers have proven very well for us that there is not just a market there. There's a very strong market there, and that the value is the right value, and we're hitting it with this technology.
Yeah. Yes, I have been part of some of those conversations, and I think what's interesting to me, and Andy, you mentioned this, there's been a lot of hype around AI. It's one of the things that I felt that there was a very common bond between these organizations. When you think about it, it's not AI for AI's sake, right? It's AI for the purpose of driving a specific outcome. Right, TeleTracking didn't have an AI strategy, in quotes. It had an outcome strategy. And what I see in the partnership between faculty and TeleTracking is now we're jointly focused on extending that outcome strategy through the use of different technologies and different skill sets and things of that nature to the benefit of our clients and their patients around the world. So, Andy, the next question is to you. Faculty's been in the AI space for a decade now. Actually, just celebrated your 10th anniversary.
Yeah.
Congratulations again. Excuse me. And how has the evolution of AI technology in healthcare changed from your perspective over the years? And more importantly, given your position and quite frankly, your expertise, where do you see it heading next?
Yeah, it's an exciting time to be in AI. Like, I mean, you can't miss all of the announcements on the news these days. From my perspective, like it's been like we started the company because we saw the potential of AI, and I think before most people saw the potential. So when we started, we like AI was like a cute innovation project that like maybe some organizations were doing on the side, maybe like a sort of somewhat insightful engineer was like playing with on the side of their desk, but it was really not something that end users cared about, that the senior leaders of organizations cared about, and it certainly wasn't like a boardroom topic. And um, and so we've seen firsthand like the shift from cheap technology through to like critical for like the strategic future of most organizations. And so what that's meant is a few things. We've gone from innovation and POCs to actually having to deal with the sort of the concrete realities of deploying this technology into the real world. And we've touched on that. Safety and robustness are like critical, but you don't really need to care about when you think about a sort of POC. I think the other thing that's changed is the expectations. And so Chris and Mike, you've both spoken about like the sort of, I guess, demand for AI from your customers, but also needing it to be grounded in an outcome rather than just some cool technology. And that's exactly right. And that is like, I think there's a what comes with that, and I feel it is a sort of sense of responsibility of doing this right. Because I think there will be um, like people need this sort of technology to help them, and it has real promise. But I think there's going to be a lot of false promises that people make, and I feel like with this partnership that responsibility to do it right, so that it actually impacts patients and it impacts nurses and it impacts just hospital systems. So I do think like it's moved from POCs and that's great, but it's like core to everything. And then I guess in terms of where I think it's going, um, the the sort of fundamental models just keep getting more powerful, and they're like ability to plan and to reason and to just generally analyze information very quickly is just gets better month by month. And so my expectation is that we're going to start to see some very, very powerful agentic AI systems that really change the sort of experience that we as humans have interacting with technology. Like we'll be able to speak with our systems, we'll be able to speak with TeleTracking as a user in a sort of natural language way that we would usually sort of think about as how we interact with our colleagues. And so I think that AI systems are going to become more agentic, and they're going to become more like teammates, and we're going to uh, have similar expectations of our teammates around performance and explaining what they're doing, but it will feel much more like we've got AI as part of our team rather than a tool that's sort of running somewhere.
Yeah, I think the way I think of it is AI for the future. I think of AI, when I think of today is, flow is happening to a patient, to a nurse, to a doctor, to EVS or transport employees. It's just happening to them. And what I expect the future to be is that it's happening to them in a smart way, and they don't know that it's happening to them. And then, as Andy said, the agent aspect of it is going to be key, because that it's not only happening to them, it's also happening for them, and somebody is helping them along the way. So having the concept of these agents to be able to be smart and help you do work is going to be very critical to what people see as the future of AI. But it's just that AI is just a natural part of in the future. It's just a natural part of work. People don't know differently that it's happening to them, or they're using AI. It's just there.
So in answering that question, you also foreshadowed some work already underway. That's great. So I'll direct this question to both of you. What role do you believe that AI will play in addressing the growing demand for healthcare services, especially in light of the current challenges around staffing shortages and increasing patient volumes and numbers?
Yeah, I think you pretty much said it, Andy, and I pretty much kind of reaffirmed that a bit in terms of where we see it happening. Obviously, when you start talking about staffing shortages, you need to empower those people to be able to do what they do well, which is care for people. Agents aren't going to be able to care for people effectively, not anytime in the near future, right? Maybe we can get to the point where we have really good agents and get embedded inside of humanoids. At that point in time, maybe there'll be some level of care. But humans provide care. The things that people need when they're in a hospital is the love and care in the touch of a human. So AI will enable them back to be able to do that, because from a staffing perspective, they can't do it today because they're drawn away doing documentation, making sure other things are being accomplished when they should be really providing that care. So I think as you scale these concepts, as you scale AI, scale these agents, you're going to, at some point in the future, just enable the nurse to be the nurse that she wanted to be. So I think that's going to be the key of it in the long run. It's just they'll get back to being why they want to be a nurse and caring for humans.
That's exactly right. Like, I see it as automating a bunch of the drudgery, whilst keeping humans in the loop, so that nurses and doctors can actually focus on the things that they're like especially good at, the things that they enjoy doing. And I think, weirdly, I think with AI getting more powerful, the world becomes more human. It becomes less about the technology and it becomes more about the people. Because ultimately, as Mike, as you were saying, like uh, people want to interact with people. And I think that's something that I think is quite it's just quite powerful. Like AI increasing our humanity rather than reducing it.
I like that, actually. And I happen to agree with it. And I think if you think about they've talked about for a number of years the wave of people aging patients and things of that nature. UCLA recently came out with a study that in the U.S. the expectation is that hospital occupancy will be 85% and above within the next 7 years for all U.S. hospitals. And so when you think about capacity and what is in place there, without a focus on efficiency, without a focus on productivity, we are in a serious problem. But we cannot lose the humanity, and I think that's an excellent point, Andy, as you mentioned it. And I think, quite frankly, the efforts and the collective efforts that we have underway are actually helping restore that humanity in that area. So the last question to end for both of you, what is the one thing? There's always that one thing question or two things questions, and this one I'm going to make it easy. What is the one thing that you're most excited about in the faculty and TeleTracking relationship?
Like, you go first.
Other than the fact that I get to spend more time with Andy and team in the UK, there there is, I mean, obviously, I'm just excited about how we're empowering the end user, which has been a different model than I've seen in the past for us, and I'm sorry, for this industry. And I feel like AI has been forced upon people and they don't yet really know why. In this case, we're going to let them make the decisions. And so I'm really excited about how we didn't look at AI as a way to just do something. We looked at it as a way to increase their engagement from an end user standpoint and make them more powerful, or empowering them. That to me is the key and the most exciting part for me with faculty.
Yeah, I think that's right. I think from my perspective, the thing that's always excited me working in technology has been like what I think of as these magical moments, where um, a user is using the technology. They don't really feel like they're using the technology, but they're blown away by what it does. And it's like to them it feels like magic, but to me, I know it's technology. Uh, and those I love those moments, like when I can sort of stand behind a user and like see them using the thing that we've built, and they just think it's magic. And it's magic to them because it's helping them do what they need to do quicker, faster, better. But but to them, it's just like this beautiful, like sort of synthesis of technology and design and user experience and understanding the problem, just all baked together into these like magical moments.
Wonderful. I think I love the magical moments, and I think we are in one. What I would say, and just kind of to wrap it up, I think there's many things to be excited about in this partnership. I think if you look at it from what these two organizations were built for purpose to do, when you bring them together, it is a force multiplier from my standpoint at this moment in time. TeleTracking has been in a relatively slow moving market development over 35 years as healthcare operations has become more and more solidified as a category in a space. Obviously, you, Andy, over the last 10 years have been in a rapidly developing, particularly the last few years. But combined, I see two companies that were built to do what they do. TeleTracking creates unique data. It creates visibility that did not exist before, and it helps make things move inside of a healthcare system. With the work that faculty has done, both your expertise and what you've done with the computational twin, it is a collaboration that helps lift all ships, so to speak, and to the benefit of the caregivers and their patients that we work with every day across multiple countries. So I believe we have an opportunity to prove what we've proven independently in a microeconomic way, and a macroeconomic way, as we focus on this space. And if you look at the continuing trends of healthcare costs and where those costs are wasted in inefficient operations. So I think we're on something that is spectacular. I'm very excited about it. I love the fact that we have partners that we can call not just colleagues, but friends in this process. I love that our technologies and our independent know-how comes together in a way that is not overlapping, but augmenting on both sides of that equation. So very much appreciate everyone's time and the opportunity to chat with you today in this recording. And thank you very much. Look forward to seeing you again soon in person.